Let me thank all of the panelists. Every one of you made extremely important issues, and I hope very much that this committee will act on some of your thoughts. Let me start off, and I must confess that until fairly recently, I did not appreciate this issue. Until a couple of years ago, we had some young people from Howard University coming into the office, and they were chatting, and one young woman was talking about the experience her mom had going to a physician's office and not being taken seriously and so forth. And I know all of you in various ways have raised the issue. So let me ask, I think many Americans would say, hey, there's a physician. What difference does it make, white, black, Latino, who cares, as long as it's a good doctor? What difference does it make for going to a physician who kind of understands your life, maybe comes from your community? What difference does it make? Dr. Lawson, you want to start? We'll go right down the line.
Absolutely. It makes a huge difference. Me, myself, in practice, many times the trust, when I build trust, my patients really do respect and comply with therapy. It is not uncommon for me to experience many of my patients may go to, a physician of a different race or ethnicity and question, right, the treatments that they're prescribed, or have given me or provided personal experiences where they weren't respected within the system, or they were provided treatments that were inadequate or substandard, or not even given options, especially being an OBGYN. I don't have to tell you that historically so many women, black women, Latino women, underwent hysterectomies unnecessarily. The options of childbirth were taken away from them. And so these are everyday experiences.
Good. Thank you very much. Please be brief. I want to hear from everybody. Dr. Cook?
Yes, sir. Thank you so much, Chairman Sanders. It is really an issue of cultural competence. You don't understand the perspectives and the concerns of people from other races as well as they do for themselves. We grow up in similar situations. We know very similar circumstances that happen to all of our families. And as Dr. Lawson alluded to, there's an inherent mistrust. We saw that even with COVID vaccinations and the inability to get Black Americans to even take those vaccinations. So it's a widespread problem, and it will only improve with more representation.
Thank you very much. Dr. Galvez?
Yeah, for the Latino.
Microphone, yeah.
Thank you. For the Latino population, the patient-physician concordance is so important to have that cultural competency, to decrease miscommunication. And the language component for Latinos in particular is very important because things can get lost in translation. A story I can think of is a patient comes in, their child needs a surgery, has a congenital hand difference, and everything gets discussed in the visit, but the family is more worried about general anesthesia, and that question doesn't get asked or doesn't get fully addressed. And so they leave the visit. They maybe booked the surgery because someone said, we're ready to do the surgery, you got to fix this problem. They booked the surgery, but then the patient just cancels because they're so concerned and they didn't get their questions answered. And so that miscommunication results in delays in care.
Dr. Andreades.
I think, for patients, especially in my field of trauma surgery, I meet patients on their worst day. I am of Puerto Rican descent, so in being able to speak to someone who just went through a terrible car accident or some trauma, I think gives them a breath of fresh air. And again, as the other panelists have alluded to, it's the trust that you have someone that speaks your language and looks like you at the forefront of your medical care. And I think that really makes a difference in patient satisfaction and patients trusting the healthcare system.
Thank you. Dr. Stone.
I deal with it daily when it comes to, say, prostate cancer, the difference between a black male and how he communicates and a white male, the concerns they may have, the trust factor, all of that plays into the relationship and patient compliance.
My last question, briefly, I'm running out of time here. Dr. Cook mentioned that he graduated medical school $400,000 in debt. I've talked to doctors graduating with more debt, nurses graduating with a whole lot of debt. Generally speaking, Black, Latino, Native American communities are poorer than white communities. What does the financial constrictions mean to young people in minority communities who want to pursue a career in medicine? Dr. Lawson, briefly.
Absolutely. The The financial implications can almost make it impossible to pursue the degree or be very discouraging to individuals. I myself am working on scholarships for students, but I encourage anything that we can do. I myself participated in many disadvantaged programs to fund my medical education, but I was told that I couldn't do it literally because my family did not have the resources.
If people could go to medical school without having to worry about tuition or student debt, would that make a difference in your communities like the Cook?
Of course, the price tag in itself is a barrier. Think for 1 second, if you took out $400,000 of debt and you got sick in your first year of residency, you will have no way to repay that. You will be forever in debt.
Dr. Galvez?
Those socioeconomic differences make a big difference, and the difference for Latinos in particular is the need to work. And so when you have to take on all this debt, it really is something you're deciding for your family. And the other difference that happens frequently is you have a student who has to work and do classes at the same time and pay for tuition versus a student who is in a more affluent community and has an office space to study and dedicated time. That's where these disparities begin.
Dr. Andreades?
It gives students a chance, to be able to even start to feel that a healthcare career is in their realm of possibilities, because finances and the financial burden, as again the other panelists have alluded to, really is a huge deterrent for minority students.
Good. Dr. Sloan?
I mentor a lot of kids that are bright and could be physicians, but they're deterred by the cost. So if there was a way to offset the cost, we could increase the numbers.
Good. All right. Thank you, panels.